another episode of OB-GYN Chats. This is where we try to inform the public with the experts here at OB-GYN Practice. If you haven't subscribed and liked and shared, now's the time to do so. We're joined by the specialist himself, Dr. David Nvula. Thank you always.
Yeah, thank you, Ilke, for having me also. I'm happy to be here.
Great, great.
Yes.
So we have these chats because it can change someone's life. And this time, it's about cardiovascular awareness, Doc. What does that mean?
Yes, most definitely. We are seeing that historically cardiovascular diseases was perceived to be a man's only condition. But over the years, we are coming to realize that women are actually more even affected by cardiovascular diseases and perhaps even more at risk of cardiovascular diseases because of unique characteristics that or conditions that they may have and that put them at risk. So it is very important that we raise more awareness, especially when it comes to women and cardiovascular diseases.
So why is that risk more? What are the factors, Doc?
Yes, it is more because women have, they are unique, specifically physiological and characteristics that are unique to females. And the most important one is that it is the reproductive cycle.
Yeah.
In a sense that the reproductive cycle of a woman starts with the first menstruation up to the last time when she stops her menstruation or enter into menopause. And before menopause and after menopause, they are not having any hormones, specifically estrogen. And after menopause, again, there will be no estrogen. And what we have seen is that withdrawal of estrogen, it's a key in terms of increasing the risk of a woman getting cardiovascular diseases. That is one of them. Compared to men typically continue with their hormones throughout their lifespan, even up until when they are in their late 80s, 90s. They are still exposed. But women, most of their hormones on average ends between 45 years old and 52 years old. On average, most women by 52 years old, they do not have much estrogen as they should be having produced by their body because of menopause.
Yeah.
That is one of the factors. The other factors that are important is specifically pregnancy itself. The pregnancy itself predisposes women to the risk of cardiovascular diseases, especially if a pregnancy was complicated by factors such as preterm delivery. There is an association between preterm delivery. If you are pregnant and your baby is delivered at, for instance, less than 37 weeks, that can be a marker or risk factor for cardiovascular diseases. What is even now well established and is already incorporated into the risk factors by the American Heart Association is hypertensive disorders of pregnancy. In other words, this is high blood pressure that specifically develops during pregnancy, such as what we call gestational hypertension, or even more worse, preeclampsia. It is a well now known risk factor for a woman to develop cardiovascular diseases. And this refers to conditions such as heart attack and heart failure. The other one would be conditions such as gestational diabetes. This is also diabetes that comes with pregnancy. Equally so, it is associated with the risk factor for cardiovascular diseases. There's also other conditions that are unique to pregnancy, specifically a condition that is not well spoken about or many people are not aware of, is a condition called peripartum cardiomyopathy. And this is a heart failure that specifically the cause is just caused by pregnancy. We do not know what exactly how it develops, but it's only found specifically in women that are pregnant. So all these factors predisposes patients to being at risk of cardiovascular diseases, and then also other conditions that are unique to females. Polycystic ovarian syndrome, it is associated with cardiovascular diseases. Endometriosis, it is associated with cardiovascular diseases. So there is this many unique conditions that are only found in women that are associated with cardiovascular diseases, and it's something that we need to speak about and so that women are aware and be screened.
And I think it's good we actually mention this because many times we're not aware of this.
Yes.
All these factors that you mentioned now, that's news to me. But again, preventing, because prevention is always better than cure, Doc. Like, what are the small basics that we can change, lifestyle, to prevent this from happening?
Yes. We didn't speak about the other factors that we already know about, such as high blood pressure, generally smoking, not exercising, high weight, but also to mention that women are also at risk of gaining excess weight during pregnancy. They can also play a role which they may not lose up to 20% from their baseline weight. So in terms of prevention is that one is that you need to stick to the basics, such as exercising is very important. That it is advised that at least a woman must exercise at least 150 minutes of less much intensive exercise, and then if it is intensive, at least 75 minutes per week. Then avoiding alcohol, and then staying away from smoking. Those are the basic ones, and really maintaining the weight within your normal weight range, by normal body mass index range, by eating healthy. When you eat healthy, we want food that are unprocessed, and try to focus on green foods that are fresh vegetables, and also fruits, and less unsaturated fat. Try to stay away from saturated fat. And those are some of the balanced diet that women should be engaging, but not necessarily only women, including men as well, because everyone, there are many risk factors that are common, but there are also the others. But when it comes to the others, for conditions such as endometriosis and polycystic ovarian syndrome and pregnancy, for that, some of those ones you can't really prevent them, but it's mainly screening, which is very important for you to be assessed if you are having those risks of cardiovascular diseases.
And that's my last question, Doc. The importance of screening. How regular, how often, and what does that screening entail for especially a woman?
For especially for women, what is important, one is that a woman need to be aware first,
Yeah.
to know that I am at risk of cardiovascular diseases based on the risk factors that we spoke about. So if you were delivered with you had a delivery that was complicated by conditions such as diabetes, high blood pressure, already that should be forming part of your profile risk factors, knowing that you are risk factors. But the simple way to go about is that we encouraging to know women to know their numbers. And when we say you must know your numbers, we are referring to your body mass index. You must always be aware what is your weight, and also your height. And your height is your reference, because your height does not change, but your weight changes.
Yeah.
So at every time you need to be aware what is the best weight for your height, and try to achieve that so that you stay within the normal body mass index limit. So you need to know those numbers. The other numbers that are important is the blood pressure. You always need to have, at least if you have once a year, at least you need to know your readings. And this can be done. You don't even need to go to a doctor. You go to most pharmacies, they have blood pressure cuffs monitoring. At least just know how was your blood pressure at the beginning of the year. You can make it a routine thing to have it known. And then the other one that is also not well spoken about is cholesterol.
Yeah.
Typically, many people think that high cholesterol is associated with having a high body mass index, but you find that even skinny patients
They can also have it.
they can also have it.
Wow.
Because it can be familial. Some of the cholesterol can be familiar, so it's very important that know those numbers. And then the other one obviously is to exercise, and then consume less alcohol, and then eat healthy foods. I think that would be my last advice in terms
Great.
of looking at. But the most important one, know your risk factors. And this includes issues related to pregnancy and many other conditions that may be unique to females only.
Yeah. And Doc, if they want to do screening appointments, where can they find OB-GYN practice?
Most definitely, we are situated here at Lady Pohamba Private Hospital in the Mushua Suites. We are in Unit 9A, and you'll find us here on the second floor.
Yeah.
And we'll be keen to welcome you and give you our expert opinion in terms of when it comes to your health.
Great. Exceptional service. Thank you,
Most
Doc.
definitely.
And you always serve us with great coffee and
Yes.
tea as well.
Yes.
So there you have it. You know where to find them. And the doctors will be waiting for you, or maybe somebody that you recommend that might be going through what we just spoke about. Thanks for joining us.